offense, defense. Aaron, which one do you think is better, offense or defense in this situation? Regarding the growth of your practice, um, do we just kind of hope that we're going to grow every year? Or should we get on the offense and make it happen? I guess I'm asking that in too obvious a way, aren't I, Naren?
You are. I mean, and you know me, inside. I mean, you know me really well. I'm going to say, you know what? You get on the offense and you make it happen.
Grab the ball and become the quarterback, because if you're just, well, let's just see what happens. I mean, maybe we'll grow, maybe we won't, you know.
The other
um,
thing about people who go on the offense is they set specific goals.
they
So
live
here
with
you have set a
intention.
specific goal. Yeah.
Yeah, they live with intent. And so a specific goal on that. And this has been our goal at my Life Smiles practice. We want to grow double digit annual percentage growth every year. And that means at least 10% or more. Now let's use that Stephen Covey concept, begin with the end in mind, as motivation. If your practice grows 10% or 10% every year, in 6.5 years, your practice will double in size. Just 10% growth every year. So if you're starting with $1 million practice, just use a really round number. 6.5 years from now, that'll be a $2 million practice. And if we continue that path for another 6.5 years, so 13 years from when you started, it's now a $4 million practice. Hmm. So do we want to hope for that happens, Naren, or do we want to drive it? We want to drive
Yeah.
it.
We want to drive it. Absolutely, Gary.
Yeah, and there's so many different ways that we can do that. That 10% growth challenge.
And then,
Scheduling template. Looking at how we schedule in the practice, looking at increasing our marketing to attract more of the kind of growth we like to see in the practice. But it all starts with a very intentional goal, and that's to grow at 10% or more every year.
Gary, we had an office hours recently, and thank you for inviting me. And this is for your clients. And every single one in that office hours grew 10% or more in the month of March. This happened
Yep.
less than a week ago. And some even grew 33%, if I'm not mistaken, one
What we
particular
did is we asked
practice.
them to take their best year on record,
Yeah,
best year on record, and then we would convert the annual numbers to monthly averages. And then we set the goal of growing at least 10% every month. Because if you grow 10% every month at the end of the year, you will have collectively grown 10%.
right.
And what was interesting, a doctor that felt like his practice was kind of plateaued. It's like a solo doctor, nice strong hygiene department, a very accomplished clinician, felt like it was kind of plateaued, but he was interested in growth. His numbers are more like 30%, 32% in this. Remember, we said 10% or more. And he was blown away by seeing the power of intention combined with, a specific goal, intention, and then the tactics that are going to get us there.
Exactly. Um, I know, Gary, you always don't believe in talking anyone into becoming a coaching client. I mean, you told me, like, if they're not, if they don't believe in it, it's not going to happen. So if let's say there is somebody listening to this and they want to grow 10%, would you be open to maybe having a conversation with them to
Oh,
see
I'd
if you
love
might
to.
be able to help them?
Yeah, I'm a huge fan of growth, and maybe the best context for growth is it allows us to help more patients have great oral health. So how about let's put it in that context? But yeah, let's put a link in chat so any of our listeners could schedule a coaching strategy meeting with me where I get to learn more about your practice and you get to learn more about our coaching and see if it's a good fit. Love to do that. Hey, thanks so much for watching this video. And if you found it helpful, leave a like, subscribe, and click the bell button so you'll be notified of any time we upload future videos. I think you'll enjoy our coming content. Thanks so much.